In the 1980s, the AIDS crisis ravaged communities across the country. In response, the FDA created the Accelerated Approval Pathway, allowing for an expedited approval of new drugs shown to treat serious, life-threatening conditions safely and effectively. Therapies approved through the pathway are held to the same rigorous standards as FDA's traditional pathway. The difference is that accelerated approval assesses a drug's effect on surrogate or intermediate clinical endpoints. Surrogate endpoints are measurable results that are likely to predict the ultimate benefit sought, but take a longer time to demonstrate. Where research shows that a surrogate endpoint is reasonably likely to predict the desired clinical benefit, FDA may rely on it for approval under the Accelerated Approval Pathway. FDA requires that research continue after accelerated approval to confirm the ultimate benefits do result. There are several examples of surrogate endpoints, including using reduced blood pressure to predict prevention of stroke instead of waiting years to compare stroke levels, detecting increased protein production in a fatal rare disease rather than waiting to measure whether a gene therapy extends life, relying on reduction or removal of amyloid plaques in the brain, hallmarks of Alzheimer's disease, as reasonably likely to reduce cognitive and functional decline. Surrogate endpoints provide a basis for the approval process that can deliver earlier access to treatments, whereas a clinical outcome, such as living longer, could take months or years to demonstrate. Using surrogate endpoints not only helps buy patients time, it advances research, opening up additional treatment developments. And in many cases, surrogate endpoints more accurately capture real-time disease progression or improvement. If you're someone battling a rare disease, surrogate endpoints may lead to treatment options. Of the more than 7,000 rare diseases in the US, at least 95% still have no treatments. And if you're one of the approximately 6 in 10 Americans living with a chronic illness, accelerated approval is an established, proven path to find and assess new treatments. By using surrogate endpoints, the accelerated approval pathway makes it possible for patients to access treatments at the earliest, often most critical moment possible. This pathway is a lifeline for patients and families who often face progressive diseases with no or very few treatment options. The future is promising as we expect to see more innovative treatments to not only mitigate symptoms, but to stop disease progression and ultimately cure diseases.